Waking up from the penile implant procedure, most men don't have much pain at all. This is because we perform a series of nerve blocks using numbing medicine while you're asleep. This provides relief of any discomfort for roughly 4 to 6 hours. After that medicine wears off, some men might require some pain medicine. We encourage the use of over-the-counter Tylenol as needed for pain. If your pain is not relieved by Tylenol, you'll have some stronger pain medicine available to you to be used as needed. If you don't need it, don't take it. For the first 3 days after the procedure, I recommend mostly laying around with your legs elevated on the couch. This will help reduce swelling, which will reduce your pain. It's okay to get up and walk to the fridge or get up and walk to the bathroom, but then come right back and lay down and relax. You do not need to do any wound care to the incision site. The skin will be closed using skin glue, sometimes with a little additional mesh meant to reinforce the wound. You may also notice a little skin glue and bruising on the head of the penis. This is because of the way that the cylinders are placed into the penis. You should not use any hydrogen peroxide or any ointments or creams on the incision unless given other instructions by me or a member of my team. Depending on the approach for the procedure, you may or may not have to pull down on the pump in your scrotum. For most of the implants that I do through a scrotal or penoscrotal incision, you do not have to pull down on the pump. This is because the pump is secured in a pocket by a stitch that will prevent it from riding up high. If the pump is placed through a different type of incision, like an infrapubic incision or even a circumcision type incision, then I generally recommend pulling down on the pump several times a day, every time you go urinate, once the dressing is removed. Usually this dressing is removed on the 3rd day after the procedure. The best way to avoid constipation related to pain medications is to avoid taking the pain medication if possible. Many men get by with just over-the-counter Tylenol. If you do need something stronger, feel free to take the provided pain medicine. But if you're going to take it, make sure that you take it along with the provided stool softener. If you need a gentle laxative, Miralax is a good one that's available at any pharmacy. Your main activity restriction for the first 2 weeks after the procedure is no heavy lifting over 10 pounds. You should also avoid soaking in any tubs or pools for at least 2 weeks. It's okay to shower 3 days after the procedure once the dressing has been removed. Until then, just do sponge baths. You can begin driving once you feel as though the pain is not limiting your ability to turn around and look at the cars around you. Anybody who requires stronger pain medicine, like Norco or oxycodone, should not operate a motor vehicle while taking these medications. The majority of men feel ready to go back to work roughly 2 weeks after the procedure. Some men feel ready earlier, and some men might not quite be ready at that point, especially those who have very strenuous jobs. The recovery period really varies from patient to patient. Some men don't have much pain at all and are pretty much back to normal activity 2 weeks after the procedure. In general, we don't start operating the device for about a month just to allow everything to heal ahead of time. Things to look out for in the days following the procedure are fevers, especially those over 101 degrees Fahrenheit, discharge from the incision, especially if it looks like pus, or spreading redness around the incision site. As far as appointments after the procedure, many men will have a drain placed at the time of the procedure. Assuming that you're going home after the procedure, you'll need to come back to my office the next day to have that removed. That does require an appointment, which our office will facilitate. Once that's done, you'll follow up in about 4 weeks for teaching how to use the device. Do not use the device before your appointment for teaching. If you have any penile straightening performed for Peyronie's disease at the same time, you may require another visit at 2 weeks. Once the incision is fully healed, roughly at about 4 weeks, we'll schedule an appointment to teach you how to use the device. You should not use the device before this. Some men rarely feel ready even earlier than that, in which case we can schedule accordingly. If you have any questions during your recovery period, please feel free to call my office at 216-444-1231. If it's after hours and you're not able to get a hold of somebody and it's an emergency, you should head to the nearest emergency department.